For those of you who can't see, Sherry hit the record button, so we're ready to go. It is my pleasure to welcome you to the Jackson Collaborative Network's annual meeting. And Sherry's got some slides that are going to guide our agenda. But the first thing we wanted to do is to go over the objectives for today. So trying to do this virtually. First of all, I know Sherry said it, but yesterday we had about, I would say, 50 or 60 people in the room. And we were able to really build and strengthen new relationships and connections with each other. And we have some virtual tools we're going to use today to do that with you as well. Most importantly, and the thing I think you're looking forward to, is exploring the collaborative community assessment and the updated infographics that you'll be able to use within your organizations and in your spheres of influence. And lastly, to engage in collaborative planning and discussion about how we move forward together, and have discussions about the priorities that we've identified and the action that we can take. So what does our agenda look like? After these opening remarks, we're going to talk about what systems change is and who we are and how we do that work. As I said, we're going to go over that collaborative community assessment, and Alexa is going to do just an equally amazing job as she did yesterday. And then we're going to talk about how to take action, and then some closing remarks. So that's our plan for the day. Does anybody have any questions before we move forward? All right. Well, here we go. So what the heck is the collaborative network? We wanted just to talk about that. I get asked this question all the time, and let's face it, this work is hard. So we're gonna make some sense of it. And the whole network is based on this idea of collective impact. And this term has been around a long time, but the important part is that the definition is that it's a network of community members, organizations, and institutions who advance equity by learning together and aligning and integrating their actions to achieve population systems level change. And that's why we come together, right? Why we collect data, why we're here. Collective impact is the way of working together to achieve equity through systems change. And the network exists to help facilitate that, making those connections and helping us learn together. And we're excited. We're going to have a panel of network partners who are doing some work, and they're going to share how they're using this framework to make systems change in their organizations. And there are lots of resources for systems change. The Water of Systems Change article has been really impactful. We reread it recently, so if you haven't read it, or you haven't had time to reread it, boy oh boy, go back to that. And a lot of our work is based on that work. So that's what the network is. So who is the network? The network is a collection of many parts and pieces. And a lot of times when people talk about the network, they think it's just the network council. So, we have a network staff team, and that's Sherry and Alexa and Amy and Sarah. And they are what we would call the backbone. They are the support team that help us do this work. They're the coaches. They're the people that keep us moving forward and help us learn. And then we have the Network Council, which is a group of members that really, and in person, we have the network staff stand up. You can't do that here, but you can raise your hands maybe, or literally raise your hand on this in the reactions maybe. And then we have the Network Council. The Network Council is a very specific group of people that are in charge of governance. They're part of the backbone infrastructure that supports the work. They hold us accountable to our goals and priorities, hopefully also contribute progress to those goals and priorities. The council is not the network, and the staff team is not the network. We're just part of the network. And the last and most important piece are our network partners, community members and organizations that commit to individual and collective action to address issues in our community. And this is where the real work happens, right? In our organizations and in the community, where we're talking about identifying the root causes and creating equitable solutions with community. And that is the very heart of where the work and where the real work happens in our community. And together, we're the network. So in person, we were all standing up by the end of this. We had the network staff team stand, the network council members stand, and all of the network partners. And hopefully, if you're here on the call, there are 31 of us. Everyone is raising their hands and standing right now because you're part of the network. And the crowd went wild in person. Woo! Let's see, I think we're ready to go. Are there any questions about who the network is or why we're here? I'm not following the chat, Sherry, so if anything stands out to you, we're good. Okay. So at this point, I think I am going to turn it over to the panel, right? All right, I'm going to put myself on mute.
So good morning. My name is Sarah Williams, and I am one of the network consultants at the Jackson Collaborative Network. I am.
Hey, Sarah, I just realized I didn't introduce myself.
Well, please do.
You did such a good job modeling that, and I didn't do it. So I just really quick, after I said all of that stuff, for those of you who are new to the network, my name is Monica Moser, and I work at the Jackson Community Foundation. And I'm the outgoing co-chair with Maisha Jones, who was not able to be here today. So sorry I missed that. And back to Sarah Williams.
Well, I have the pleasure of following Monica in today's meeting, and we get to talk with one maybe partner. We had I don't know, Amy, if you want to jump in and have different thoughts, but we had a couple partners set up for today, and one is not on the call. So we may just have to adapt and chat with one, which is great. So we work a lot in the network around supporting partners. I'll say so Amy and myself, we work together to help partners with strategies. We do that in a lot of different ways. We work one-on-one with partners, and also we host monthly affinity groups. We meet around what partners are doing around big root cause things like building trust in the community and how to navigate service systems and what you all are doing. What are things you're doing in your organizations to move these big things forward? And then really it offers a space for a lot of connection, which we've found seems to be the thing that kind of rises to the top. And in these affinity groups, we have really developed relationships with people and also heard about the great work they're doing. We are so excited. We asked Martha York to be a part of our panel today. And also, go ahead.
Angie's on, sorry.
Oh, Angie's here. Oh, great news. We've asked Martha York and Angie Guadagnini, who have both done great things around systems change, and to be our panelists today. And we know when we say systems change, it kind of feels like lofty maybe, or big or confusing. And we just really love these examples that these partners are doing in real life in their organizations to help move systems along. And so we have two panelists, and I'm going to move this and then Sherry, are you slide person? Yes, perfect, great. Will you move that? And then I'll have Martha, if you would introduce yourself and your agency, and then Angie, that would be great too.
Okay, well, good morning, everyone. I'm Martha York, and I work with Region 2 Area Agency on Aging. I'm also one of the co-facilitators for the Cross-Cultural Conversations Work Group, which is part of where my affiliation with this network has also been tied. And for those of you who have any vision challenges, my hair is slightly red. I am a Caucasian, near 60-year-old female wearing a gray and black outfit.
Love it. Thank you, Martha.
And I'm Angie Guadagnini. I'm the Community Resource Coordinator for the Department of Health and Human Services. Yeah, I was part of the panel yesterday, and I'm glad to be here today. And for those visually impaired, I am a gray-haired, middle 50s woman wearing a flowered shirt.
That's fantastic. Thank you for modeling that. That's great. And so we will, I will, it's not we, I will ask, and then maybe Amy might jump in. We'll see what happens.
Okay.
But I would like to ask each of you these questions individually, and if you could answer them. And then at the end, we will have a bit of time for a question and answer as well. So I'll start with you, Martha. So what is the equity or systems change problem you identified, and how did you identify it?
Well, I started in what was called a building trust group. And as I thought about who am I trying to build trust with, it really matched nicely between what was important to me personally and some areas of growth that I was trying to stretch in and be more comfortable in. And that was with welcoming and being an affirming ally for the LGBTQ plus population. That just was so important to me personally that it spills over into everything else that I'm doing. And so at our workplace, I started to think about how many people are we serving? How many people are coming through our doors who identify with the LGBTQ plus population? Would they say that they identify with this population? Would they feel like they have access to services that we would be affirming and supportive? So that's kind of where I started, was with that.
That's great. Thank you. And then Angie, I'll ask you the same question. What was your equity systems change problem you identified, and how did you identify it?
We identified a hospital policy that requires a driver to stay on site during minor procedures using sedatives for patients. It came to my attention with a very, very frustrated gentleman calling me because he had a procedure and the hospital told him he had to have somebody stay, and he's talking with Jackson Transit or Jackson Area Transportation Authority, and they're saying, well, we can't stay. So he's yelling at me saying, you need to make this happen. So that's how it came to my attention.
Thank you. And then Martha, what are, how have you, or are you working to address the problem?
Well, one of the first things that I did is when I talked about this in an affinity group, there was someone who was from the Pride organization on their board, and she invited me to come to their program committee. So I just started showing up like, okay, I'll come. I what's going on in the community? What can I help with? And we were talking about ways that older adults could receive support. And everybody was kind of like, I don't know if we've got any answers for that. What are the needs, and who, how do we reach people, and how do we let them know that we want to do this? So I started researching a group called SAGE out of Metro Detroit. They had offered us some wonderful trainings for area agencies on aging. And so I signed up for some of their trainings and got some of our staff taking their trainings, and it was terrific because two things that they suggested. One was, how do you word your questions in your intake process and your assessment processes in a way that could be affirming and welcoming and friendly, as well as what they were doing, which was having like these coffee get-together and other older adult things, and they did these these friendly calls. They had like a calling system, and I said, well, gosh, we have that already through Region 2 Area Agency on Aging. We have what we call a friendly reassurance program. And our friendly reassurance program calls people who are isolated or at home that feel, especially during the pandemic, it really grew. And now there's like even a waiting list because there's so many people who want that weekly call. And I said, well, what can we do to make sure that we capture someone who calls and wants the service, but also wants an affirming LGBTQ plus person. So I recruited a volunteer that I know is very passionate, equally passionate about this, made sure that he got trained and vetted through our organization. And then we went back and looked at some of our questioning processes too with our intakes and assessments. And we've been trying to collect data now on different populations and seeing who we are reaching and who we are not. But the questions were so awkward. And so now we've revised some of the structure of our questions that we ask during our intake process so that I can say to people, what gender do you identify with? And let them say, you know, if it's female, male, transgender, bisexual, let them kind of say that. I'll say, do you identify with the LGBTQ plus population? And some people will automatically go, oh, yes, thank you for asking, you know, and others are like, what is that? And I kind of know, well, if you're asking what is that, you probably don't identify with that population, right? So it's been a lot easier to go ahead and just naturally ask these questions and start putting up a platform that hopefully tells people right up front, hey, we're going to be there for you. You are accepted exactly as you are. No judgment. No judgment zone, right? You know, like this is so, I'm just so passionate about that. And so on the Pride Committee, we're getting ready to I've been trying to reach out and have like the AARP help us with this, but we want to promote and market our friendly reassurance program to older adults or homebound persons who do identify with the LGBTQ plus population to know that we've got a service for them that's unique and is hopefully going to be something of value.
That's great. Thank you. Angie, I'll go to you. How have you, or are you working to address this problem?
So one of the things I said yesterday with the group that we were with, I said, I feel insignificant. And Sarah jumped right in almost aggressively and and said that what I want to say right now. We are the network. So I had really nothing vested in the issue of the Henry Ford Surgery Center requirements or the Jackson area transportation requirements, but I became the voice for this gentleman that was really having a hard time communicating what he needed. So I contacted that clinic, that surgery center, and Karen Cripps, thank you so much for pointing that out because that's what I'm going to talk about. I contacted the surgery center and I asked, what is the purpose of this policy? And I was told that it's for emergencies. And I said, well, what would be an emergency that you would need the driver on site for? Well, in case they stop breathing. Well, that's a driver, and that's not a person that's going to be making any medical decisions for this person. So what if we have, an emergency phone number for you so that the driver doesn't have to stay on site? And I really didn't get very far with that conversation. And I ended up telling my boss, who's the director of the DHHS, and saying, this might go up higher, so I might need you to step in. So I had talked to, or I'd called the director of all of the centers and was forwarded to the lead counsel for Henry Ford Health System here in Jackson. And it told her the conversation that I'd had, and came back. Henry Ford came back with a plan to work with Jackson Area Transit Authority on ensuring that our patients are getting there and getting home safely, The drivers have to come into the clinic to sign in that client, that patient. They have to sign in saying that they're going to come back and give a valid phone number. So dispatch, when the client is ready to leave, dispatch then calls that driver and has them come and pick them up to take them home. And they ensure that the patient gets into their home safely, and they're not driving, because that's the safety issue that Karen mentions here is it's a safety issue. We don't want them driving. They're under anesthesia. So we can't have them driving. We don't want them wandering around the community. They need to be home. They need to be taking care of themselves and just taking it easy. And our drivers from Jackson Area Transit Authority are ensuring that.
That's great.
Yes, it
Thank
was,
you.
it was a big one.
And I love, we talked a lot yesterday. We had so many things happening.
Mhm.
But I really appreciated the point about talking about how all of us, right? It takes all of us
Yes. Yeah.
to do the work, but also just how you noticed a thing. And maybe, and you said too in our affinity group, like, I don't know if I'm the person. Am I the one? Am I going to be it? And we had a conversation around like, well, if you have a knowing and a knowledge and a wondering, then you, right. And then I'm not to spoil it, right. But we talk about sphere of influence, and maybe it's
Yep.
not like you have the power over a thing, but you certainly notice you have, and then maybe you have influence, and maybe if you don't, then it can go up. But to me, if you're wondering if you are the person, you are a part of it at least, right? And so that piece around who is significant and who is not, right? Like the fact that you're even saying like, well, I'm not sure if I'm it, right? Like to me, then you're an incredible connector, right? Because if it's not
Yep.
me, then it's someone else.
Yep.
Also, I'm not sorry about being aggressive.
No,
So.
it was really very funny, actually.
Yeah. So for those of you that were not there, there was a panel in person yesterday, and I helped moderate. I was the backup moderator. But there was some great conversation. And anyway, Angie made a comment that she wasn't significant, and I may have escorted Calvin Battles to the side a little bit so that I could
Yeah.
get to the microphone. I know. Someone did say you pushed us. You pushed him, and I was like, well, it was like a gentle. Anyway, doesn't matter. I stand by everything, and it was great. And I appreciate you sharing that.
Yeah.
And so Martha, I'll move to you. Mark says it was a nudge. Well, it was with my elbow. I was like, so Martha, I'll go to you. What is one challenge or barrier that is getting in your way or maybe got in your way?
In doing the cross-cultural conversations work, we realize how challenging it is to change mindsets, right? It's just delicate work. It's not always fun work. And as you start talking about opening your doors wide to LGBTQ, you certainly get some pushback from other people. That and one other thing that we ran into is that we as a diversity, equity, and inclusion committee in our organization, we wanted all staff to go through an implicit bias training, and not only our staff, but our advisory councils and our board of directors. Like, we just felt like it was really important that everybody at least experience this training. And there was some pushback. From people, and it can feel kind of disheartening. People are only ready for so much, and when you mandate things, people don't always show up ready, and so I would say that one of the barriers that we have are just trying to continue messaging and conversing without feeling threatening to others who aren't on the same page with you. And that means saying, you have a right to your opinions, you have a right to your beliefs, but we as an organization also have a right to what we value and how we want to make sure that we say that we're reaching everyone, that we're open to everyone, that we are not exclusive, and we mean that. And so this is some of the ways that we are doing that. So, but there has been a little bit of pushback when it comes to the DEI trainings, and that's been definitely a challenge.
Thanks for sharing that. I just can't help but notice and Dr. Shelley isn't with us today. She was in person with us yesterday. She is our DEIRJ consultant. That's the very short title for her. But she talks a lot about the inside out work. And then when we do our work together and like how when we are doing this transformative work, how we change ourselves and how we work on ourselves and then how it shows up for other people. And I just think, oh, thank you, Sherry, for putting the correct title in there. I just think you're such a great example of that, Martha. And I think you're such a great model of that. Cause like we also talked yesterday about like when you start to implement things, right? Like if you're going to hire diverse people, but then bring them into an environment that's not welcoming, not safe, not whatever, it's actually traumatizing, right? So you're actually building a culture and building an environment that says, no, this is actually how we're going to do things. And this is how we've decided we're going to do that. And that actually came about from the work you're doing on your individual self. And I just love that. I think that's such a great example of the inside out work because I can't help change things if I'm remaining the same.
Well, I'm glad you worded it that way, Sarah. And I just have to say, this is it is a personal journey, and I think the thing that I had to really start doing is pushing myself to show up in different ways. Like I knew how I felt and I knew how I believed, but it was sort of like secret. and yet to start going to events and start like the other thing that has rolled out of this is becoming part of the military coalition's new work in our community and trying to reword what the questions that we ask so it's friendly to people who've served in the military, and not asking someone, are you a veteran? And then inadvertently turning people away because they don't identify as a veteran, but they've served in the military. So I've just been learning and trying to just show up and keep learning, right? I need to, sometimes you go, oh, not another meeting, right? But
Yeah.
and truthfully, I do that a lot because I'm in a lot of meetings. But when I do show up, inevitably at the end, I'm like, oh, that was definitely worth my time. I learned something or I made a connection and I grew,
I love that. Thank you for sharing. Angie, we'll go to you. And what is a challenge or barrier that is getting or got in your way?
So one of the things that we found in talking with the lead counsel was a misunderstanding by staff on the purpose of that policy. So staff thinking and telling folks that the reason your driver has to stay on site is because in case of emergency, you stop breathing. And that's actually, it's not why the driver has to stay. The driver has to stay because the patient can't drive and they want to make sure that that driver gets the patient home safely and gets them in their house safely. So just the barrier was the misunderstanding of the policy. So I drew attention to that and we'll talk next about how it's been fixed.
Great. Thank you. And Martha, so what progress have you made so far?
Well, the revision of the questioning process with our intake and our data collection is already underway at our organization. And not only there, but I also, I run a statewide collaborative with other program coordinators with the Area Agency on Aging. So I've made that suggestion to modify our wording in that data collection across the state. So I'm excited about that it's not just a Jackson presence, that it's all the way across the state. And that wording is just more affirming and friendly and updated. So there's that. And then same thing with the military coalition and learning about the, how to do our intake and our assessments and making sure that our staff are learning about how to word those things. Bringing in more military culture awareness through Alyssa Harris's work. We've gotten some wonderful training materials and things that are being shared with our staff. So we're making progress. Where I want a giant rainbow on my website. I'm not there yet, but just things like that, right? We're working on it.
I love that. And also we talked a little bit yesterday about the ripple effect of things.
Mhm.
And sometimes often, right? It's like unintentional. You didn't realize that by doing this thing that would lead to this thing. And as we talk about equity and always centering equity and all the work that you both are doing and many of us on the call are doing are really centered around trying to support a group of people that do not have the same supports or are experiencing higher levels of oppression by systems built that way, intended, right, that way. And I love, Martha, your examples because you listed two populations that are not, I'll say, right, that are different to your personal identity, but that you are then putting extra effort in to learn and then adjust things based on that knowledge. And I don't know how, like, that's not going to stop, right? Because like the natural progression is like, oh my gosh, now that I'm done, I figured out military stuff. I didn't even know about this community over here, or where are we in our, in our DEIRJ work? Where are we on this? And that's just, it's all of it, right?
Oh my gosh, so much so, so much so. And in fact, when you invited me to be on this panel, I'm like, I've just got a teeny little thing that I've done, but it takes all of us doing teeny little things and suddenly it becomes more natural. I just want it to be just a more natural part of our way of operation. I really do. And you're right, that will spread to all of those underserved populations in a way that hopefully we can get more equitably served.
Oh, I love that. And again, with your thinking you've done a teeny thing, this is really, you're changing the way your organization is working and running in the culture you're setting. And that will not only impact the populations you serve, but like you even said, like the interactions you have in the community, frankly, the reputation you might end up having in like all of that ripples. And then they're like, did you know that that Martha's agency is like doing this? Oh my, like to me, it's infinite, right? Like how it ripples.
Well, it started for me, the military thing. Thank you for your comment there, Karen. I have a neighbor a few doors down from me that retired from the military, came home to take care of her dad. And we chat when I'm out walking my dog. Like that's the nature of our interactions. And her dog had died recently and she was really grieving. And we were talking about that. And I said, for what it's worth, I joined this military coalition just because I just want to be supportive in a different way. She goes, oh, so you can understand how weird we all are and how weird we think. And I said, if that's what you want to call it, yeah. But, like I do, I just want to better understand. And I just said, for what it's worth, this is something that I'm doing. But I just think it's important that we let people know too, what we're involved in, because you never know who's going to say that made a difference to me. That makes me feel that much more connected. That makes me feel that much more supported. And it's just showing up. We just need people to show up, right?
I love it. Thank you so much. Angie, I'll move to your question. What progress have you made so far?
So we are considering this issue a win because there was no policy change. However, there was explanation of that policy and new direction for the staff that are enforcing the policy. Jackson, I became an intermediary with the Jackson Area Transit Authority and Henry Ford. So Henry Ford sent me some questions that they wanted the drivers to answer, or Jackson Area Transit to answer, so that they could make sure that the drivers are going to come back, because that apparently had been an issue in the past. So we thought we were only talking about a handful of people that this was going to help. So when you say that we're just making this little thing, so I learned yesterday in that ripple effect, it's not just that one little thing, it's that one little thing that you did that is affecting so many more people. So they made Henry Ford and JATA, they worked together to come up with a plan. So Henry Ford is now scheduling those folks who are using public transportation earlier in the day. So there's not that issue of them, rides to wellness not being available after 5. So they're scheduling them earlier in the day. The drivers are bringing the patient in, they're signing in when the patient is ready to leave. Henry Ford is calling the dispatch center at JADA, and JADA is sending the driver back. The driver comes in, gets the patient, takes them out to the vehicle, takes them home, and makes sure they get into their home safely. So we came up with the solution for those folks. When I said that this is only a small population, so there's only a few that have zero supports. They don't have family members that can take a day off work, or a friend that can take a day off work. They're literally on their own. But what we anticipate is that this is going to get out, right? That people are going to start talking, that, those folks that have not completed medical procedures because they didn't have that transportation are going to find out now, and they're going to call us so that they can get that transportation set up for those procedures. So what we're hoping is that ripple effect is going to ripple into the community of those folks who don't have any hard and fast supports, but that look to their neighborhoods and their neighbors and their friend groups, and have those words to share so they can get those medical needs met as well.
I love that. Thank you for sharing. And I love how both of your examples, right? And when we talk about equity, and, Angie, we were talking about how this policy unintentionally, likely, right, impacted this group of people disproportionately. And when we talked yesterday, just about how that could affect their life and care, and are they seeking treatment, et cetera. And so by seeing a problem, investigating, and then we talked yesterday, Dr. Shelley, too, about why is this policy even in place? What is the point? Is there a point, right? And your conversation with Henry Ford, and to be able to say oh, well, you didn't mean harm, maybe, right? So how can we edit this a little bit to, and then you elevating that issue and making connections, will undoubtedly have a ripple effect, right? And help bring those people that need extra supports, the support they need. Yeah. I love it. I'm all warm and fuzzy. No one's surprised by that, though. So if I think we have a bit of time for question and answer. Does anyone have maybe they want to raise their hand, or if that's too difficult to figure out, could unmute and ask Martha or Angie any questions they have about their process.
Sarah, I'm going to stop sharing slides so we can see faces better.
Sure.
So I'm going to do that real quick.
So, Miss Angie, my name is Karen. I used to be a nurse clinical coordinator at Henry Ford, the main hospital. So I did work hand in hand with the surgery center.
Yep.
I currently am a school nurse, but I still pick up their PRN. This was a huge issue, and I'm so glad that you are addressing this with the community, because I have taken a patient home before who had family, who has had nothing. So I do want to tell you, as a facility, it was being talked about in our monthly meetings, and that I'm so glad. We do have currently a new director, and so thank you so much for what you're doing.
You're welcome.
Doesn't seem so small now, does it, Angie?
Well, it seems like any one of us could have done that. Any one of us could have made a phone call, and so it seems like okay, yeah. It wasn't that big a deal. I just made a phone call. But for those folks that it is affecting, it is a big deal. So, and I do recognize that those folks that don't have the support, they need the support. They need those medical procedures. And if that's the reason they're not getting it, let's fix it.
I just will lastly say they are taking account every day of people who are delayed for discharge because of rides. So the department is already monitoring that and looking into that further.
Good.
ADHD now. And every time the mom is mentioning like he's on waiting list, he's on waiting list, he's on waiting list, and she's like, I've been doing this. I'm like, oh, I really appreciate it.
It seems to me that those types of questions and needs can be added into the care hub, so we can do a deeper dive on intake as well. I mean, because these are all issues that are gonna, you know, as Sarah says, ripple through the community, right? I mean, if you don't have family members that can get you to the doctor, if you don't have proper insurance to get in through that door, these are all things you have to know up front. And if us as a community, we have a tool, it might not be utilized as well as it could be. These are all things that we could add in and strengthen, right?
And transportation is a huge issue for so many of our folks. And not just for medical. I only take care of medical appointments, but grocery shopping, when you can only take 2 bags on the bus and you have to carry them on with you. So if you have a little one and 2 bags, you know, you have to juggle a lot. So yeah, transportation's huge. Socialization, all of it.
So, but I guess like if we're like.
And Martha, I will say, I am so glad that you are doing the Pride Center program stuff and jumping in there. I also jumped in to the Pride Center and as an ally, and it's wonderful to see how much, once you put it out there, how many people are supportive and are allies and didn't really know they were. So I'm glad you're doing that.
Thank you, Angie. Yeah, I saw your name on there and I was like, oh, I know her. Affinity group.
Yeah.
So I get to do the friendly time check. We have about 4 more minutes. And I know we are hoping to invite others to share their own system change wins if that's something folks would like to add to the chat or share out loud. We have a few minutes. Well, Sarah, it sounds like we don't have any other questions or discussion. Anything you want folks to know or understand before we move on to our next piece?
No, I don't think so. And like Sherry said, you know, yesterday we had a wins wall with Post-its, so we're adapting a little bit today. But if you have anything after hearing, you know, the examples that Martha and Angie gave, if you want to share any wins in the chat, you know, for others to see, we're going to gather them and share them out later. We're also an opportunity for us to connect with you later, or maybe you have something you're working on and you're stuck. We would love to connect with you on that. Feel free to utilize the chat for that as well. I just wanted to really thank Martha and Angie for their great work and their dedication of time and thoughtfulness today, and really just being lovely humans who do this great work.
Thank you. You as well, Sarah. Thank you.
Thank you, guys. Also, I want to remind you too, if you're not ready to share in the chat, kind of the things that you're doing, wins around equity or system change wins, reach out to Sarah and I kind of individually too, because we can walk you through it. We can make sure that, you know, if you start to address a problem and you, like Sarah said, you get stuck, we can work through it. We can help kind of transition into more system level change. So we dig a little bit deeper, but we are available to kind of work through. And it's just great examples of big and small. Like there are system change things that are really like feel heavy and complicated, but there are simple things that we do each and every day that make a difference. So thanks.
Okay, well, on that note, I am going to reshare my screen so we can see the slides here. All right, and I'm going to turn it over to Monica and Alexa, who are going to get us started on the collaborative community assessment. The information we've all been waiting for, right? This is the, you know, feels like there should be a drum roll. Dun, dun, dun.
I think there should be a drum roll. That'd be cool. I don't know how to make that happen, but I don't have a drum.
We'll take it away.
All right. So, You know, the collaborative community assessment is part of our shared measures system. And so Alexa and I are going to talk a little bit about that. At a really high level, you know, one of the 5 conditions of collective impact is a shared measurement system. And that's part of setting a shared vision, right? So that we all understand the direction that we want to go. And in Jackson, we've developed this really handy little pyramid to help us kind of set the shared measurement system in stone virtually, because stone, pyramid, get it? Okay. And this measurement system helps us clarify our goals, creates accountability for change, organizes us for greater impact. Putting this shared measure system together took years and lots of work from all of the partners in the network. And in your packets that Sherry sent, you'll see a more detailed version, or it's in the let's see, it's was it in the link that you sent yeah. And so there's a deeper version that actually shows the root causes that were identified by members of our community through thousands and thousands of pieces of data that we received and whittled down to 14 root causes. And the function of our network is to assist our partners to organize for greater impact. And as we organized or developed our shared measure system, it helps us kind of guide our work. So with the vision at the top, that we envision a healthy, safe, thriving community for us all to live in. And the core function of this work is, like I said, to clarify our goals, create accountability for change, organize us for greater impact, and guide, most importantly, to guide our strategy design. And you'll see that it's based in values that we've identified, that we are just, that we are engaged, that we are learning. And part of today is that supporting that value, that we are learning together. And then our aim, so boiling down our work to what we aim to change in the community. We've come up with 5 aims. Our basic needs are met, we are safe, we are healthy, we are resilient, and we reach our full potential. And then you'll see the goals at the bottom, what we hope to achieve. And so let's go to the next slide, Sherry. So we've been doing a community assessment for a long time. A formal community process was designed and implemented by network partners, the network and partners, to better understand our community conditions and broaden to actually understand our residents' experiences specific to the root causes and those social determinants of health. So the collaborative community assessment has 3 main pieces. The first is a collaborative community assessment phone survey. We hire a consultant to do that work. The committee, the Shared Measurement System Committee, and if you love this work and you want to be on the Shared Measurement System Committee, reach out to Alexa because it's super awesome work and we get to work with Alexa. So, but that, you know, with the consultant, we're developing the questions that are brought in to include questions around the social determinants of health. Then there's secondary data that's collected from credited from sources like the Annie A. Casey Foundation for the Kids Count, the National Citizen Survey, the County Health Rankings, the Michigan Profile for Healthy Youth, and others. And that data helps support our understanding of some of the information that we gather from residents. And then finally, qualitative data that we would collect from our residents to understand the issues even more deeply. or once we have some data, to dig a little deeper into the root causes of why that data might exist the way it does. And that qualitative data will be the next huge body of work that the shared measures system team will be working on. So originally the collaborative community assessment began in 2005, and it happens every 3 years. And you'll see when Alexa shares some of the data, some of it's comparable to 2019 or even earlier data, and she'll show that comparison. It's the core, this assessment is the core component and one of the primary ways that we collect and report data and share our progress on goals and priorities. And it helps guide our work, right? So that we know where we want to go. Alexa, is there anything you want to add about the history of the collaborative community assessment?
No, I think that you absolutely killed it, Monica, just like yesterday. Thank you.
Yeah, I forgot yesterday to talk about our secondary resources. And I was like, oh,
It works out in the end, right?
yeah. So Alexa's going to walk us through the data through our shared aims. So take it away, Alexa.
So before that, so this is a point when I maybe somewhat aggressively jumped in yesterday, so I want to make sure to do it again today. I apologize. But we're about to look at data that looks at disparities that are present. So I want us to be sure to have the appropriate mindset and lens as we're looking at those disparities. So the data that we're sharing today, the data that you'll find in the report and in the infographics, those are outcomes produced by the systems that support our community residents. So we need to be thinking about these outcomes and the disparities that we see as a way of understanding how well our services and supports and systems are meeting the needs of our residents or not. So it's a way to help us understand what's happening. It doesn't necessarily tell us why. And by itself, this data is not actionable. You will not leave here today knowing exactly what to do about what you've seen or heard. There's work to be done after you leave this conversation today to be sure that you're connecting with those that are experiencing those outcomes to better understand what's happening and why, so that then you can work with those folks that you serve to understand what needs to happen to make it better. So I just want to throw that out there, that we're going to learn a lot of things today. We're going to hear a lot of great data, some of it not so great, and encourage folks to ask questions throughout if you need clarity on any of the data points. And we have a good chunk of time set aside right after Alexa's presentation to open it up for discussion. And then there's activities that Zoe and Amy are going to lead us through later to actually help us process a little bit. So that's what I wanted to add. Did I miss anything important before you jump in, Alexa?
No, I think we're good.
Okay. All right. I'm going to advance the slide and mute myself. So take it away.
Hi, everybody. My name is Alexa Burgai, and I am the Data and Information Specialist for the Jackson Collaborative Network. I also serve, as Monica mentioned, the staff lead for the Shared Measurement System Work Group, as well as the project manager for our Collaborative Community Assessment Project. So I am here for all of your data needs, and we're going to jump into it. So the way this data presentation is going to work is I am going to go through it by aim. So we'll just read off the aim, and then we'll go into talking about the goals of that aim, and then we're going to dig into some data points. So as Sherry mentioned, please make note of any questions you have as we're going through, and then we'll have time at the end for Q&A. And if there's anything you need clarified on the slides itself, go ahead, raise your hand during that time so we can make sure that everybody's kind of understanding what exactly is being displayed if there's those clarifying questions. So first one we're going to cover is our basic needs are met. Okay, so on this slide, we see the 3 goals that are underneath our aim of our basic needs are met. And I know exactly what everybody is thinking right now. They're like, there are only 3 goals. That does not even cover all of the things we need to be tracking and measuring for our basic needs are met. And I'm just going to say this now. Underneath these goals are a bunch of leading indicators that also help us track and measure progress. So these are kind of our big high level goals that we're tracking. And then we have a bunch of little guys underneath of there. So for our basic needs are met, our goals are increasing availability of affordable housing, reducing rates of food insecurity, and increasing percent of residents reporting access to quality healthcare. All right, data pieces. So on this slide, we're taking a look at annual household income. And what's presented here is a comparison between our Black African American residents and our white residents. So this data source is coming from our collaborative community assessment phone survey for 2021. So our most recent data on this. Throughout the presentation, you'll see a lot of the phone survey data. We're trying to highlight it this year. So I really want to focus people's attention on the left-hand side, so that less than 15,000 and the 15,000 to 24, 999,000. We're seeing about like 51% of our Black African American residents are making less than $25,000 a year, compared to only 22% of our white residents. Less than $25,000 a year is definitely into that poverty level. So taking a huge chunk of seeing that large disparity between our Black African American residents and our white residents. And we can also see this huge disparity in those making more than 50,000. So we see only 20% of our Black African American residents making more than 50,000, and then 42% of our white residents making that.
Hey, Alexa, this is Kate. Just
Hi, Kate.
clarifying, your data here is countywide?
Yep, so this
the
is,
county. Yeah, okay. Just
yeah,
not
yep.
the city. Yeah.
Nope, not the city, this is county. Thanks, Kate. Kate, a huge shout out to Kate. She is one of our co-chairs of our shared measurement system work group, and we appreciate her very much.
I just have one quick question. This is Tasha.
Hi, Tasha.
Hi. Do you have breakouts for the city? Because I
Yeah.
know that has to be even worse, but.
Yep, so if you look into the collaborative community assessment report, there is a breakdown, and it shows the Black African American white breakdown race, and then also a place-based. So it'll show you city versus out county. So those living within the city limits, and then residents who are living outside of the city limits. Yep.
Thank you.
Yeah. All right, we can move forward whenever you're ready. Okay, home ownership. So on here, it's another collaborative community assessment phone survey result, and we're seeing 41% of our Black African American residents own their home, compared to 72% of our white residents. This is again countywide, and we can break it down further. This is just what we're displaying today, just to see this really large disparity between home ownership and race categories. All right, now moving on to food insecurity. Again, collaborative community assessment phone survey. The specific question for this one is asking if residents, how worried residents are feeling about having enough money to buy nutritious meals. And so less than 30% countywide residents say that they are always, usually, or sometimes feeling worried about having enough money to buy nutritious meals. And then when we look at our breakdown, we're seeing almost 50% of our Black African American residents are feeling that worriedness of being able to have enough money to afford nutritious meals, compared to about 27% of our white residents.
Alexa, I was going to add,
Yeah.
This came up yesterday as we were talking about some of the basic needs data. Folks were wondering about the impact of COVID and some of the relief efforts and specific basic needs supports that have been put in place. So clearly those things are kind of part of the water that we're all swimming in, but it was not a specific focus of the community assessment survey when it was conducted. So we're not able to directly make those connections through this data, but it is something to be aware of that was present in our community as all of this data was being collected. So just wanted to call that out. And there is that piece in the report. There's a little part at the beginning that gives a little bit of data around what was true about COVID at the time. Thank you. Shout out to Megan for pulling that together for the group. But yeah, just wanted to call that out because that was part of the discussion yesterday that folks really felt was important to understand. So
Thank you, Sherry. All right, moving into our next aim. So next one we're going to talk about are We Are Safe. And here are our goals for We Are Safe. So we're talking about reducing rate of violent crime in Jackson County, and then increasing the percent of residents with a positive perception of safety. Okay, starting off with feeling of safety in home. So 68% of Jackson County residents reported that they feel very safe in their home. When we take a look at this broken down, we see 50% of our Black African American residents report feeling very safe, compared to 70% of our white residents. So bringing this kind of back to something that Tasha kind of raised in a couple of slides ago, is a lot of our Black African American residents do live within the city limits, and our white residents do mainly live outside of city limits. So this might be an interesting one to take a look at in the report. I think it gives us more of a breakdown, not just from Black African American and white comparison, but also city versus out county. Just trying to plug the report as much as I can today. Okay, feeling of safety in neighborhood. This question specifically asks if how safe residents feel working out in their neighborhood during the day. So we see 58% of Jackson County residents feel completely safe to work out in their neighborhood during the day. On the left-hand side, we're seeing that place-based disparity. So 48% of City of Jackson residents feel completely safe, compared to 63% of residents living outside of the city feel very safe. And then we can see on the right-hand side are race-based disparities. So 41% of Black African American residents feel completely safe to work out in their neighborhood during the day, compared to 60% of white residents who feel completely safe to work out in their neighborhood during the day. Okay. So rate of violent crime. This is a rate per 100,000 population. We get this from County Health Rankings. On here, we're seeing a comparison between Jackson County, that dark blue bar, the light blue bar is Michigan, and then the gray bar is United States. So we see in 2018, Jackson was a little bit lower than Michigan and United States, but jumping to 2021, we see those rates rise quite a bit. So now we are above Michigan and United States rate. And I just want to be, so violent crime rate, this includes any like face-to-face confrontation between a perpetrator and a victim. So this could include things such as rape, aggravated assault, homicide, robbery. And in 2021, Jackson County was actually in the top 10 of the highest rate of violent crimes in Michigan, and it was number 8. So over the years, the violent crime rate has raised quite a bit. Okay, we are healthy. We're just scooting right along in these. Okay, and here are our goals for We Are Healthy: decreasing years of potential life lost, as well as increasing percent of residents with positive self-reported health status. Okay, so lack of healthcare coverage. These percentages are the percentages of Jackson County residents without healthcare coverage. This is coming from our 2021 Collaborative Community Assessment Phone Survey. So we're seeing the past couple of years. So in 2014, 11%, quite high, down to 5% in 2017. And then we're seeing a bit of a spike for 2021. So since 2017 or since 2014, we've seen a slight decrease and then quite a bit of an uptick. And so for a bit of a comparison, according to county health rankings, Michigan's percent of residents without healthcare coverage is around 7%, with counties in Michigan ranking somewhere between 5 and 13%. Okay, infant mortality rate. This is a 3-year moving average and it's per 1,000 live births. And I want to know, the gray bar is our Black African American infants. The dark blue is Jackson County and the light blue is white infants. We are seeing our Black African American infants that are about 5 times more likely to die before their first birthday than white infants in Jackson County. So as you can see, the gray line is our Black African American infants and the light blue is our white infants. So this is kind of a hard one to look at, and it's been that way for quite a bit of years.
Sorry, I know I'm supposed to advance the slides, but I feel like this one just needs a moment.
It's very impactful. This is included in the report, the graph. It's also a large portion of our infographics as well. Like this graph is presented there as well, because seeing it laid out in this format is truly so impactful. So.
Well, and this is another spot to really just focus on, this data is not about individuals or individual behavior. This is about systems.
Mhm.
This is about systems that produce results that aren't equitable across all populations. So be thinking about that as you dig deeper into the report, because you'll see disparities like this show up by race, geography, anyway. I will move on, but just know that I know many of us are feeling heavy right now.
Yeah, I also want to say for the infant mortality rate too, there within that section of the report, it does talk about like lack of prenatal care and all of that. So if this is really impacting you, I truly encourage you to take a look at the report, because it does dig in quite a bit around these statistics.
And the great news is people on this call and people that were in the room with us yesterday for the in-person annual meeting, folks that are part of our network, have influence over the systems that can help make this different. So that's the responsibility we all carry with us after today. So I will step down and move on. But, all right.
Okay. So years of potential life lost. Everybody pauses and they're like, I have no idea what this means. So I put a little definition on the screen for you. So it's premature death that measures the risk of dying before the age of 75. This is from county health rankings and is a rate per 100,000 lives. So this is an important measure for like community health, because a lot of this focuses on deaths that probably or may have been prevented. So here we see on the left-hand side, the Jackson County bar of 8,200. We see Black African American in that dark blue of 11,300. And then to the right, our light blue bar, white residents of 7,800. So here we're seeing that Black African American years of potential life lost is quite a bit higher than Jackson County overall. and especially our white residents. As a comparison, for Michigan, overall, their years of potential life lost is 7,500. All right, moving on to we are resilient. And then our goal for We Are Resilient is increasing youth protective factors. Okay, starting off with students reporting 2 or more adverse childhood experiences, and those adverse childhood experiences is also known as ACEs. So on the left-hand side, we can see the list of adverse childhood experiences. And I'm just going to give a quick shout out to Zoe Lyons. She is our resident local expert on ACEs, and she helped us out yesterday. So, and on the right-hand side, we see 33% of middle school students are reporting 2 or more ACEs, and 40% of high school students are reporting 2 or more ACEs. This is extremely important for us to pay attention to because experiencing ACEs has been linked to negative outcomes in later life, such as risky behavior, chronic health conditions, low life potential, as well as early death. So since 2016, high school students reporting ACEs has stayed the same, and middle school students has decreased slightly by about 2%.
Quick call out for the report again, because we can't mention that enough. But so in the report, there's also a breakdown by grade level. So you can actually see the impact that these ACEs have on children, even in high school, middle school. So you'll see data broken down by students that are achieving A's and B's for grades, and C's and D's kind of broken down. So it's interesting to look at that way and helps us better understand who we might need to talk with and learn more about. So
yeah, I will also just put a plug. This is from the MyFi, the Michigan profile, on healthy youth. So this is publicly accessed data. You can dig into it if you would like. It also, as Sherry noted, it does a grade breakdown, but it also breaks it down by race as well as gender, just in the MyFi itself too. So if you're interested, I encourage people to take a look. Okay, here we are highlighting middle school student suicide risk. So as we can see in 2016, 8%, 2018, 12%, and then it rose up to 14% in 2020. So as I think all of us, suicide risk has truly become something that a lot of people are paying more and more attention to as the years go on, which is amazing. We are seeing this increase, and just to kind of relate it back to something that Sherry said earlier, is we all know that COVID took quite a hit on people's mental health, especially our young people. So taking a look at this is quite a bit. And I do want to say that the middle school students have steadily increased, in high school students reporting ever attempting suicide has stayed between 11 to 12% since 2016. So we have quite high rates for our middle and high school students. And this again is MyFi data. If anybody, this is resonating with you and you'd like to take a look at it, it's also included in our report.
So someone was attending yesterday's annual meeting in person that works with the MyFi data a little more regularly than we do. And they had mentioned that this jump, they were feeling it was somewhat connected to the ideation data, that what we're seeing is not that more and more kids are having ideas or contemplating suicide, that we're seeing more of the actual attempts. So that would be an interesting thing for those that work with this youth data to look at a little more closely. We didn't have the resources in the room to do that yesterday, but that was something that came up in discussion that would be interesting for folks that are working with these populations. And Alyssa, I see your comment in the chat, and that would be really interesting to learn more about for Jackson County, is if we do have a comprehensive, if all schools are taking the same level of the MiFi, or if we do have some differences there. That'd be interesting to look into.
That used to be a pretty big deal, because I think JPS didn't fully participate for a number of years. And so we were always really wondering how accurate our data was.
That is good to know.
But it's only been recently that all 13 school districts in Jackson have even participated. So that, I think the first year that we had all 13 schools do that was in 2020. So it's very recent. And that's not saying, and it harkens back to what Alyssa was mentioning, but it doesn't mean that they're taking the comprehensive. That just means each school is participating minimally. And the fact that, you know, you can gather all the data points and look at the root causes and issues that our children and family are dealing with. But when you're on the school work groups, you know, access to mental health services, access to services is the #1 issue in the county for minors working with kids. And the families feel they're overwhelmed with their needs here. And there's a lack of service, and those of us that are, you know, even tangentially connected to those industries know that. And it's quite the battle. It's it takes a lot out of you.
I love that comment that Mark and actually Alyssa in the chat said as well. In my previous role before this, I actually worked at the Department of Ed in the school health and safety unit, and my unit helped develop the MiFi. I sat in on meetings actually trying to change questions and had no luck. But Jackson is known for a really high rate of taking the MiFi. Obviously when you tie things to funding, it always helps, like you are required to take this, but because Michigan is a local control state, right? Like school districts can decide what they want to do. And I think this ties nicely into the mindset conversation that we had yesterday, we might have later today, right? Around like, how can you change systems if you can't change mindsets? And if you have administrators and communities thinking me saying the word suicide or me saying the word sex is going to blow everything up, like you have to get to the point where people are comfortable doing that. And that's like that step, building relationships piece. But I'll be quiet now. This isn't my section, but I do love the conversation.
Well, you're right, Sarah. I don't mean to hijack this point, but you know, with the Student Justice Partnership Group, since 2014, we've been looking at attendance rates and chronic absenteeism and parental engagement, right? And in 2017, all the school systems were connected to the Power School data collection process or system for the first time. And they're able to look at and compare absence rates, and how each school coded those, you know, data points. So when we're going through this data collection and comparing and contrasting how the different schools, even the different buildings, are collecting that data, it was impossible with the number of variables that were being used. And so we tried to condense those into a much smaller range for more competent and more consistent data collection. And the superintendents didn't want their data to be compared. So it was top end barriers that we ran into on a consistent basis, even when we're just trying to look at community-wide barriers for their families and why they can't engage them or get the kids in the seats. So mindsets and resource allocation, you know, the two top issues that we're running into, along with power, right?
I absolutely love this data. Like it just brings like little niches of people together so that we can try to make take action on those shared goals and priorities. And I encourage all of the discussions, and maybe this is something that we could do a data brief on, and we could bring a bunch of people together. So I'm going to keep that in mind. Thank you for the discussion, everyone. Okay, so our next data point is another in your face one that we need to pay attention to, is the perception of treatment due to race. This is a question that we included in the 2021 Collaborative Community Assessment Phone Survey this year. And it specifically asks residents if they felt like they were treated worse than other races, treated better than other races, the same as other races. So here we see 6% of Jackson County residents, so this is Jackson County wide, report feeling that they were treated worse than other races. When we take a look at this broken down by race, it is quite the difference, where we see 25% of our Black African American residents report that they felt they were treated worse than other races, compared to 4% of our white residents. Just not a lot you got to say about that one, as it's very staggering to see.
Alexa, this is Zoe, and I feel like this conversation around our students and our residents, I just want to also point out the importance of all of us being engaged in our school district. So we had a conversation yesterday in person around I had seen the news article about the 4 people who were running for Northwest School Board, and they were all white men. And Nick Rush and I had a conversation, right? Because he was like, we want, did you read the article? And he said what was scary in the article was actually that 2 of those men very clearly are anti-LGBTQ. They're sort of the amongst the group of folks who are going out to all of the school boards and talking against DEI and so I know Nancy Peters Lewis has been very verbal about us, the others of us in the community really being able to mobilize. But I just feel like, putting that in the room, not necessarily for additional conversation, but just for thinking about how we each and together can make a difference in that way. Because if we don't, this data is just going to get worse.
I appreciate you, Zoe, for saying that. I also think that this will, if people could continue to think about that, especially during our next activity, how all of us collectively, if we just have a little piece, it will make a big difference. So I think that we can all carry that through.
Can I ask a question? This is Sarah. I'm sorry for joining late, and I also apologize because I probably have to jump off early as well. So my apologies. But for the slide that you just showed, I just had a point of clarification. So the 6% is overall 6% of respondents felt that they were treated worse.
Yeah.
Is the data below that 25% of those that felt worse? So
no, so this is within Black African American residents reporting that.
So 25% overall reported that they feel worse. And then if you add it all together, that totaled 6% of the whole survey.
Yeah. So,
okay.
Yeah. So
they're not related. Basically, 25% is not a subset of the 6%.
Exactly.
Okay. Well, thank you.
So the 25% is looking at specifically Black African American residents. So you're almost taking all of their respondents and isolating them and looking at their responses separately. Yep.
Okay, thank you.
Does that, hopefully that's clarifying.
Yep, thank you.
Yeah. Okay, moving on to our last aim, and then we'll have time for Q&A at the end. Okay, so we achieve our full potential.
I'm sorry to jump in. I'm just noticing a little bit of chat. So each cycle, when we work on the community assessment project, we bring together the shared measurement system work group and others to really think about the questions that are asked, the things that we need to be able to better understand. So lots of great feedback on, I wonder what it would have been if we asked this question. I wonder about this. Can we know this? These are all great things that help us improve each and every time that this assessment process happens. So if you have feedback about the process itself, the questions, the data points that are available now versus what might be necessary or might be helpful to you in the future, please feel free to share those either in the chat today, or you can always follow up with Alexa and I as well. Kate's also someone you can talk to if you're interacting with her in different spaces. So please, keep the information flowing because the assessment is only as good as we make it. So help is always needed to help improve that. So
I'm going to go and say a step further. If this is just lighting a fire underneath of you and you want to talk more about it, please, please, please join my shared measurement system work group. I could use all of the people. So I'm just going to put that out there. And yeah, I have my hands on my hips while I'm sitting down while I said that. So, okay, we're achieving our full potential. The goals for this are increasing the percent of kids demonstrating readiness for kindergarten, increasing the percent of adults with valuable credential, and then reducing percent of families living in poverty. The first one we're running into is children in poverty. So this is a statistic from County Health Rankings. And from 2019 to 2021, we see an overall decrease in the amount of children in poverty. When we're looking from the race perspective, from the breakdown, the amount of Black African-American children in poverty compared to white children continues to just be huge. Like in 2021, 49% of Black children are in poverty compared to 16% of white children. So that's 2021 data.
and again, you can find city versus county in the report. And, if you have additional wonderings, you can always get in touch with Alexa to look deeper into the data. But this is one that we've called out, for the last several assessment rounds, as you can see, like there's work to be done.
Okay, educational attainment for residents over 25 years old. This is taken from the US Census this year, or it's the 2019 5-year estimates, I'm sorry. So we're seeing 3 bars. One bar, the dark blue is Black African-American residents, light blue is white residents, and gray is Jackson County overall. I think this is a very great example of how skewed almost the data is. So we're seeing on the left-hand side that 16% of Black African-American residents did not complete high school compared to 9% of white residents and 8% of gray, which is the Jackson County. And then scooting over, we see 15% of Black African-American residents achieved a bachelor's degree at educational attainment, 22% of white residents, and 23% of Jackson County. If you were all in the room yesterday, you would have heard earlier in the day during the panel, Nancy talked about quite a bit of educational attainment and kids going into programming. And it literally just completely reflected what we're showing here. So
Zoe, not to just call you out without any notice, but you made a great comment about the tuition incentive program and Medicaid eligibility yesterday. And I know folks on this call would benefit from hearing it and also sharing that information. Would you mind sharing?
Yeah, so well, Nancy actually shared about the TIP program and that you're eligible for the tuition incentive program, which gives a free 2 years of college at a community college for any child that has been on Medicaid for 2 or more years since their 9th birthday. And so a couple things. One thing, I was working with Nancy about how we can make sure everyone who is eligible knows about that here in Jackson County. But also with the pandemic, no Medicaid cases have closed since March, or I would say since April of 2020. No, so, and that's over 2 years. So anyone who is over the age of 9 who's been on Medicaid during this COVID time will be eligible for this tuition incentive program, which could really increase our numbers of students who can use that. So so you know, passing the word and making sure that people know that is really important.
And I know the College and Career Access Center is a resource for understanding that, but is there a website or anywhere folks could go if they wanted to share information?
Yeah, I can find that and put it in the chat.
Perfect. Thank you so much.
You bet.
Okay, so this is going to be our last data point before we move into Q&A. So here we're seeing residents reporting set aside emergency funds. So we're highlighting this because a lot of financial experts say having like 3 months of expenses set aside is pretty standard for things such as emergencies, economic downturn, or in case of sickness or job loss. And here we're seeing 37% of our Black African American residents in Jackson County have these savings set aside compared to 60% of our white residents. So highlighting this disparity, and also I'm putting it out there that in the report, we go over a couple of different savings metrics that we measure through the Collaborative Community Assessment phone survey. Some were added this year, including this question. So we don't have previous years to compare with, but savings overall, we see this disparity.
Alexa, it's Kate again with a clarifying question. Is when you say set aside emergency fund, what are you identifying? Is this the Federal Reserve's $400 or is it 3 months that you were talking about?
So, yep. So it's the 3 months of your expenses. So whatever you would need to sustain an expense for those 3 months, that's what they are calling emergency funds. And now is time for all the questions and answering. I know we have a little bit less time than we initially wanted, but I see the chat is just blowing up and I cannot wait to look at all of it. So anybody have any burning questions?
So I know today was just meant to like kind of tiptoe into the data. I mean, you'll notice we only covered just a couple of data points for each AIM. So we would love to hear from you as you look into the tools a bit deeper and look at that report, start taking a look and reflecting on how that data, you know, what has implications for the work that you're doing within your organization, the work that you're doing in the community. And this doesn't have to be the only time we get together to talk about it. So I know that if you're like me, you need a minute to process, and you probably haven't read I've lost track of how many pages is in the report, but this isn't the only opportunity. So feel free to reach out afterwards if you would benefit or it would be valuable to get together again to talk through things. So back to Q&A because we do have a few minutes.
I think, sorry, just a comment. I think that obviously the data and information is amazing. I think that certain like maybe data points or topics would be interesting to break out in Jackson anyway, in Jackson County. with the data for the city versus the out county, because that's going to say something. Is, you know, I was thinking about that, especially like with the educational achievement piece. I think it would be interesting to know, you know, how rural kids are doing versus urban kids and things like that with, or kids, it was 25-year-olds, but, you know, like achievement versus, you know, graduation rates and college rates. The same kind of thing would be an interesting comparison for, you know, health outcomes and things like that. We know there's disparities with access to resources in the different communities. And I think that, you know, some of those comparisons would be useful for people or interesting. I also think that, I would suspect, and this is me now just sort of thinking out loud, I guess, but I would expect that some of the racial disparities between white and Black folks would be, how would I put it? The people living in the city would be more analogous, and the people living in the rural areas would be more analogous versus people countywide, if that makes sense. You know what I'm saying? And that would be, but maybe not. So it would be interesting to compare those datas as well to know that.
Yeah, so I'm gonna give a slight spoiler alert to people. We're gonna be doing like data briefs. So these are gonna focus on like one particular topic with like breakdowns and such. So if you have those that you think are gonna be so interesting and impactful to people, email me, let me know. I am so happy to talk about all of the data all of the time. I am literally here and put in this backbone staff position to help all of you have the data you need to drive action and accountability on our shared goals and priorities. I am super reachable, I promise. I am so happy to talk to everybody. So if you have those that you want to take a look at or that would help you in your organization, please, please, please reach out to me. Thank you, Michael.
Thanks.
So I do think we're almost coming up on having to take a bit of a break. But like, I'm just gonna reiterate, the report is a really wonderful resource. The infographics this year hopefully are a really wonderful resource for everybody. And again, I am a resource for all of you. So please feel free to reach out to me if you have any questions about the report as you dig in, or anything you want to dig into deeper. I'm happy to talk about it.
Sherry, can I ask them to do something special while they are taking a break?
I would love that, Zoe. Go for it.
So because we're not in person, I would like to ask you to during this break, while you're just contemplating all of the information that we've gone over this morning, just take a little step outside, whether you're in your office or your house, and pick up a little stone and bring it into the house or the office with you, because it's gonna be part of our next exercise. So just get a little sunshine. It's a beautiful day, and pick up a little rock, stone, pebble, whatever, and bring it back in with you.
And on that note, we will break for 10 minutes. So please go ahead and return at 10:51, and we will see you in a few moments. And share our slides again. There we go. So welcome back from break. And Alexa, I'll let you take it from here.
Oh, thanks, Sherry. So I am going to be covering just a little bit of information on the report and infographics. Okay, so here is the front cover of the 2022 Collaborative Community Assessment Report. I know everybody is like, what is the green and the red thing on the front of the cover? AKA a question Maisha Jones, our council co-chair, posed. That was an art installation that was next to consumers. And then this is a picture of downtown Jackson. So I know Sherry included a link to the Collaborative Community Assessment Report in the chat earlier today and included it in our meeting reminder. So you can access this online through our jacksoncollaborative.network.org website as well. so easily accessible, easily downloadable. And the data in the report is organized and aligned through our shared measurement system. So I know earlier today, our data presentation was through the AIMS, and that's how the report, as well as the infographics this year, kind of organized the data. So those in person yesterday received a hard copy of the report, and so you all will not be getting one, unfortunately, but the good news is these are easily printable. So the digital version was shared with you. If for some reason you're like, I absolutely need to have these professionally printed, I can give you a print bleed copy. I don't know when you would need to do that, but just know that we are able to work with you if you absolutely need that. So feel free to save it, download it, and use it, all of the things. So this year, I do want to highlight, I think Sherry mentioned it earlier, there are a couple of new sections this year. One includes the COVID-19 section, another gigantic, huge shout out to the ever wonderful Megan Albertson, who helped develop that section for us this year. So she's on the call today. Everybody give her a quick shout out and yes, claps. So also something that is added this year is the data sources section. So this is located in the back of the report, and it gives you direct links to all of the publicly available data sources that we use. So everybody can join in on digging into the data and taking a look at things. So, okay. Hope you're muted, Sherry.
Sorry, looking for the mute button, it keeps hiding.
Yeah.
So I was just going to mention too, the sampling and methodology, sorry, the words won't roll off my tongue. All of that information is in the beginning of the report. So a lot of the background, the context to help you understand what the data represents, what it does and does not represent is in that beginning section. There's also a little overview about the network and about some of the history of the assessment. So this tool that you have at your fingertips now is a result of years and years of work that was done by the health system and the health improvement organization. And now the network is also helping with that as well. So all that information is really great. I know it's easy for us all to jump right into the data, but some of that context at the beginning is important, especially if you're going to hand this off to other folks. So just keep that in mind. All right.
Okay, and then here is a slide of collage, wonderful collage of all of our infographics for this year. So there are 5 infographics aligned with our aims of the shared measurement system. So the format is a little bit different this year. They all are formatted to print very nicely on a legal size piece of paper. And I mean, it gives us a lot of data points that we need. So everything we covered today in the data portion of our presentation is located within at least in the report and or the infographics. So everybody should be able to take a look at them. Sarah in the comments, gorgeous. So yeah.
I failed to give a shout out yesterday. It's not often I saw Megan's comment, data glory. It's not often folks that work with data get a lot of glory, but I want to call out Alexa specifically because these infographics are a result of her efforts to not only teach herself new tools, but to work on like marketing stuff. And these are beautiful. Like yesterday, holding them in our hands, like these are gorgeous. And we listened to folks the last time we printed infographics. We made them more accessible to you because we know that you want to be able to print these, you want to be able to share them. And having posters is great, but we didn't have a tool last time that turned those great posters into something you could carry around. So several of you printed the large posters, and that was a barrier for some. So they're just beautiful. So yeah, feel free to print them, and they're gorgeous. And
yeah, and they should look good in black and white as well, because I know some of us don't have access to even color printing. So if there's anybody who, is printing in black and white, they should be able to be readable and distinguishable through that as well. So data ninja skills are always appreciated. Bethany, oh, I love you. So those are our tools. Use them, distribute them. Again, Sherry sent them out in the link, and they're easily accessible on the jacksoncollaborative.network.org website. Oh, I am supposed to pass it on to Sherry to give an introduction.
To Zoe, yes. So Zoe, I'll pass it to you now.
Thank you. Thank you. So we're just going to do a little kind of review of Collective Impact 101. And as I mentioned yesterday, I'm not necessarily one to stay on script. And I am also one who really likes it to be super simple to understand, right? And you start reading about collective impact and you can easily sort of get lost in the verbiage. So I'm just going to kind of go through these things. I mean, so what is collective impact on the left-hand side of the slide? A way of aligning and integrating the efforts of many partners around shared goals and priorities to achieve equity. That's the definition, right? How does that look when we do it in our communities? How does it look specifically when we do it here in Jackson? Well, there's these 5 conditions of successful collective impact. First is a common agenda. That shared definition of the problem. In Jackson, we've really had a really great focus on equity, right? We started learning the difference between equity and equality. We've talked about race equity and equity in our marginalized and oppressed populations. Who are affected? And do we all agree? Are we together in this shared definition of the problem? Certainly these infographics and all of this data helps us be together in that, right? The shared measurement system, that's our vision, our values, our aims, and our goals, and that we all agree to track and report progress in how we are going to be working on this. It's about mutually reinforcing activities, the affinity groups that JCN brings together, ways that we can come together to coordinate and align what we're doing. Again, back up to number 1, in alignment with that common agenda, right? So what are we doing around equity in our community? Continuous communication, building trust and relationships. This type of gathering helps us with that continuous communication. But I have to say, and I said this yesterday, if you have ever worked in another community, you are now here in Jackson, you have to know how amazing Jackson is in terms of coming together and working relationships, having trust. We still have trust to build. It's not across all sectors, right? We still have trust to build, but the fact that so many of us are here in this space together right now, it's truly amazing. And it does not happen in all other communities. This is a standout in terms of our relationships. And then the backbone infrastructure that we have. I was thinking about this a little bit more and I was like, we all have day jobs, right? We all have day jobs and we're so busy. And frankly, if it wasn't for people like Sherry and Amy and Alexa and Sarah, this would not stay front and center necessarily for me, not in the way that it needs to, not in the collective way that it needs to as this community work is done. And so, having a team that's really dedicated to keeping us all connected is also part of how we are such an amazing community here in Jackson as well. So what do we do with our collective impact? It's about working together, right? So, when we're addressing large, complex problems, like the root causes issues that lead to equity issues, some of these solutions can be overwhelming. So this image of this single person pushing this huge boulder, which includes making service systems easier to navigate, right? couple years ago when we all came together, you might remember that we talked about this boulder piece, right? And we actually talked about breaking the boulder up into small, more manageable pieces, and that heavy lift becomes something more manageable. Hence the reason that I asked you all to have a little rock in your hand, a little stone, a little pebble, right? We are able to make changes when we each take our individual little piece, our pebble, and begin lifting that ourselves, right? And I was also thinking, since my husband and I just got back from Denver, it's not also about the heavy lift, but it's also the steep climb sometimes. So even though you're holding a little pebble, when it's a steep climb, you need to take a breather. You need to take care of yourself, right? Don't let your heart rate get too high before you keep walking. So, so just being able to take your little piece and move it forward. One of the things that I did in Jackson is we created a standing DEI learning agenda item for my board. So every board meeting, we have a standing item. We're going to do some DEI learning. And I'll never forget the first day it was added onto the agenda, and I shared with my board that we were going to add this on as a standing agenda item. One of the people in my meeting said, do I have to participate? And I wasn't really expecting that. And I said, well, I suppose you could leave the room during that part of the agenda. And we went on because I wasn't going to let one person remove what I thought was an important step forward, right? And that person stays, does not leave the board meetings when we do DEI learning. And so I feel like it's moving it even a pebble at a time, right? Like we're making, that person is there and they're listening. And so maybe I'm planting seeds. Maybe I'm taking that pebble and lifting it a little bit further. So we just start to see and think about, the things that we can influence. Where's our sphere? What is it that we can do? And think about maybe where we don't have influence, but we can support others. And so as we look at this next slide, that little sort of light purple circle, the control where we as individuals can make changes happen, right? So I'm the director of the Jackson DHHS office. So in my building, I'm that sort of top person. However, in the state of Michigan, Department of Health and Human Services, I'm not even close. So I have a regional manager and he has an administrative director, and then there's the deputy directors for the department and it goes all the way up to the governor, right? So I can make some changes and control some things in my office. So not only did I make a standing DEI agenda item for my board, but it's required for all of the meetings that happen within my office. So when my leadership team has staff meetings, when we have program meetings, there is DEI learning that happens in those meetings as well. And I was able to create an anti-racism transformation team, and we've just started that. Many people on this call are part of our team, and we're excited about that. But then we think about influence, right? I might not control a change, but can I leverage my capacity to influence that change? Are there things that I can do to help with that influence? Again, sometimes that might be planting seeds or a small lift with that pebble versus, pushing a boulder. How can I influence that? And then finally, where is it that I can support? This is a place where the action doesn't need to be taken by me. It needs to be taken by others, but how can I support it? And, frankly, what we're learning, thank goodness, in Jackson, and again, I don't think this is being learned everywhere, is that this support is maybe here in Jackson for some of our grassroots organizations, right? To listen to the members of our community who said, Yeah, thanks for trying for the last, 20 to 200 years. But your answers haven't been the change for us. So if you support us, we would appreciate that. And here's what we need to do. So just really looking at your sphere of influence, what you can do yourself, what you can take action to help others do, and how you can support the change that needs to happen. Again, all in support of our common agenda and the collective that we can be here in Jackson. So what we would like to do now is I'd just like to have you take a minute. I want you to take your pebble, your stone, your rock that you picked up, and I want you to just kind of sit back in your chair, and I want you to hold it. I want you to maybe, I have mine here, like rub it between your hands as you're thinking, take some deep breaths, feel what it feels like, and just think about how you take that stone, that pebble, and push something forward, lift that little piece. What is that going to be for you? What are the things that you have the power over that you can begin to initiate? So just take a minute and think about that before we move on.
Okay, I'm going to jump in. And I do want us to give us more time to think about these things, and we are going to have time. And actually, we're going to build off each other when we break out, because we really want to think thoughtfully about this. So this is where we're moving to action, right? We see this data, the data is presented, and we take a collective gasp on like, oh my goodness, look at this. And in years past, there's been times where we've walked away and just been sad about it. And we really we've talked about, so we've got the data points. We've talked about collectively, we can make a difference. These are big root cause issues that are complex, and it takes a lot of different organizations and thoughts and feelings around it to make movement on these things. And we also know that we all have power and influence. Zoe did a great job talking about the different levels of that. We heard about that this morning when we talked about even the small system change things that were made. It's the little steps, it's the little pebbles, and then that affects the system in a whole. So we're going to challenge you. We're going to take a few minutes to break out into groups of 3 or 4 people. Sherry, did you have something?
Before we break out, I'm not sure if everyone knows who you are, Amy. Or
I'm
what
sorry, I
role
should have
is.
introduced myself.
That is
honey.
okay. I just was trying to find a spot to break in.
Yeah,
I think it would help for folks to understand your role. Because it fits right in with what we're asking people to do.
It does. Sorry, I apologize.
No,
so I just see so many friendly faces that I just assume. So my name is Amy Foers, and I'm a consultant, one of the backbone staff that Zoe referred to with the Jackson Collaborative Network. Sarah and I work together with partners to kind of move some of your the things that you've identified in your organizations into actionable things. So we're here as assistants. We can help when you get a data piece, when you find an issue in your organization that you get stuck with, we are here to help walk that through. And that is, so these data books come out and we get all geeked up, and we quickly turn to the page that has our data piece on there, and we're like, okay, I need more. I need this broken out by city and county and things like that. We can help you do that with Alexa's assistance. We can dig deep into it. And then we're going to encourage you guys to go to that next step, right? So you've got the data, you disaggregate that data, you jump into like, what's next, right? Next is hearing from those folks that are closest to the problem, right? We need, as Zoe said, folks know what they need in our community. We need to kind of get out of the way and listen to what they have as solutions and make them part of building those strategies, right? So we've done a lot of learning convenings, and we host the affinity groups where we come in and we say, wow, we've got this inequity in our community. And then we'll kind of say, go to those folks that are experiencing it, find out what that actual experience is, build those relationships and look deeper into what is really deeper in the issue. You know, we talk about the 5 whys. Well, why is that happening? Why? So we really, we're here to help kind of move you through that. And we're here to challenge you that each of us have a responsibility to take action, but big or small. We can't just take a look at this data and go, oh, that's so sad, and then go back to our 9-to-5 job. So, so yes, sorry, a lot in there, but so yeah, we're gonna break out into groups today. We think about, you're gonna need more data, like I just talked about. You're probably seeing this brief thing that we put on the slide. We're gonna dig into it deeper. We're gonna be able to help assist you in kind of disaggregating that data, but think about that data piece that we talked about today, or that you already know about, that relates to your work. And then think about your sphere of influence. Like, what can I do in my organization? Who do I need to bring along? Who do I need to hear from? And then we're going to break out into groups of 3 or 4 folks. We're going to have about 10 minutes, right, Sherry, 10 minutes to talk about that in our groups. And then when we come back, we're going to actually ask you to take that action. What can I do around this data piece or around this issue that I've identified? And we're going to have you put that in the chat. That's going to be your pebble of influence, right? As Zoe said, hold on to that pebble while you're breaking out, and feel the power that you have within your organization, and write in the chat when we get back what you plan on doing about that. And it may be I need a little more information, and it may be I need to hear more about it from those closest to the problem. But we really want some strong commitments today. And then once you put that in, we can help walk you through that.
And from a logistical standpoint, we'll be compiling all of those commitments along with folks who made commitments yesterday. It was really cool. We had little pebbles that people posted on the wall. It was very visual and exciting to see the work take shape. But we'll be pulling all that together so that you can see that body of work together in one spot. And that we can also help with Amy and Sarah's leadership, help really identify connections that would be helpful, you know, areas of opportunity to pull folks together that might be working on similar problems or similar issues, create opportunities like this to drill down into those issues or problems in a more focused way. So yeah, so I'm going to break us out into groups, and there should be between 4 and 5 in your group, just based on our numbers. So you'll have 10 minutes. I will give you about a 2-minute warning when you get close. Does anyone need the question or any further instructions from Amy to know what we're doing when we get in that room?
If we could have the question in the chat, that'd be great.
Okay, I will post it 1 second here. And let me just get that question real quick. I want to post it before we go so that you can keep a hold of that. All right, that question is in the chat. Hopefully you'll be able to see it when you get out. If not, someone can message me. But all right, we are going to take 10 minutes in our breakout rooms. Here we go. I'll see you in a few. Welcome back. Welcome back, everybody. I'm going to go ahead and share my slides. So our question is up on the screen again.
Welcome back. Yeah.
Yes, this is the transparent facilitation moment. We did not talk about what would happen when you all come back. So Amy, I'm not sure, are you taking it from here?
I sure will. Yeah. So welcome back. So I know that was a big ask. I think that, you know, we kind of tease that we're changing the world one Zoom room at a time, because it's tough. We gave you 10 minutes. There's probably lots more digging that you want to do around the issues. We give you just tidbits of data. So it was a big ask, but I think that I'm hoping there were some really rich discussions in your breakout, a lot. And I also acknowledge that folks are short-staffed, and there are, you know, we're dealing with emergent issues, and going into those deeper system type changes, it's hard right now, but that's the only way we're going to affect long-term change. we're gonna, actually, Sherry, I'm gonna pass it back to you because you have the breakout rooms, and you know, room 1, 2, and 3. We're gonna ask folks to, if you identified an action that you can take kind of right off the bat, let's put those in the chat. If you want to just put your name and like, I commit to looking at this policy or adjusting the way we work around this practice, pop those in the chat. We can help follow up, or even if you identified that this is a thing and I don't know where to go with it, because we'll have that ability to reach out with you after the event. So put anything that you've kind of identified or that you're working toward or that you want to work toward in the chat. And then we're going to ask someone from each breakout group just to give one thing that stuck out from them, or a little overview of what was talked about in that breakout group.
Sure. Okay. Thank you, Amy. So be doing that work in the chat while the group is reflecting on what happened in our breakouts. So room 1 included Bethany, Danielle, Kara, Karen, Megan, and Monica. Is anyone from that group willing to give 1 or 2 highlights?
Come on. Oh, Monica's our leader. I've already spoken so much today. I think the majority of our folks were really thinking about needing to share the data with their leadership, like that starting place, which is, we were talking about how big of that's not just a pebble in your pocket. That's a big first step. We talked about how, making the data so accessible is a really important thing that the networks support. I mean, that is just so valuable. And not just the community assessment data, but those other key, the county health rankings, those other key pieces of data that will help our organizations and our leaders, the individuals, move forward. So it's kind of what we were talking about. How cool. And thank you. Alexa, you got lots of kudos in our group about that heavy lift of making that data come alive.
Yeah, so keep in mind, if you don't hear from her, if she's a little quiet for the next few days, she might just be resting. And that is, maybe all of us will be in that space too, but yeah. Okay, thank you for that. So room 2 included Connie, Courtney, Jackie, Robin, Sarah, and Vanessa. And I'm going to challenge the group not to have Sarah be the reporter, because I know that staff often are looked to provide that or fill that space. So if there's someone from that group who wouldn't mind sharing, just 1 or 2 highlights.
I can, if that's okay with the group. We just talked about, so we had and I can't remember the year, Sherry, Monica, Zoe, we had these data sets years and years ago, and they were printed out and we had them on the wall and did activities, and we have some of them hanging in our office actually still. So we talked about having seen some of the data sets before, although some of these sets are different now and have some different measures in them. I was talking about from a systems perspective in the large child welfare system, the infant mortality disparities always get me. They got me the last time, they get me this time. And then all of the initiatives and the work that we do internally within our child welfare system to really combat those numbers and affect that. And then what's left to do, the work that we still need to do, the disparity that we still need to address, and how to affect that in such a large system, and what we need to do better. And kind of attacking it from a different angle, maybe then, we've focused a lot on the education piece, which is important with parents, new parents. My thoughts on this, the community piece, internally, the systems piece internally within our communities, maybe we can have some more impact there. So I think just those numbers, that always startles me. and all the groups, like it definitely goes up and down, and it has come down, but the disparity is still huge, and the numbers are still too high, way too high. So that always gets me. We just kind of talked about any particular data sets that stood out. And then if anybody else from the group wants to share, please do.
Great job.
Well, I'm going to move on to room 3, which this group included Anne, Bobby, Ebony, Jennifer, and Tasha. Who would like to share?
I don't know, Anne, I thought you had some really good info. If you wanted to share on that.
Sure. So I took some notes about what everyone mentioned. Bringing DEI experiences into your work meetings is something that we can all keep in mind and do more of. Supporting people of color in our organizations, and continuing to work on our personal journeys. There are some things that I personally am working with different organizations to bring conversations around racism and the impacts of it, and conversations within teen LGBTQ communities around just reading and spending time together and providing some supportive spaces. And although those seem like 2 small programs, there's been a surprising amount of resistance to them for several years now. So I commit personally to continuing to forward those spaces for people, despite the discomfort that I might be experiencing or that others might experience with the idea of that being necessary.
Thank you. Thank you. So keep them coming in the chat while we're sharing out at a group level. So room 4 included Amy, Annette, Brian, Michael, and Zoe. And again, I would challenge someone from the group other than Amy, since she is a member of the staff team, to share out.
So I think Brian and I were going to co-do this, but I'll just say that a common thing that we all talked about in our own organizations is that we all kind of have had a focus on equity over the past several years, an increased focus, but already that was a focus of our work because of some of that data that you're talking about. The work that we do is already focused on marginalized populations because that's who needs our services. So, Brian, what would you add to that?
That was so brilliant. I don't know that I could add to it. But yeah, the more I participate in these sort of meetings, the more I feel honestly blessed to be a part of the College and Career Access Center. And already since, I've been with the agency, this has always been our focus, are always, looking at equity, looking at the most vulnerable populations and bringing our services to them. And as I look at, the infographic and all of those percentages and the disparity that exist, I feel like a lot of that can be addressed with post-secondary education, career training, putting yourself in a place where you can, take advantage of career opportunities that are going to give you the financial security that are going to lead to the shrinking numbers in all of these other areas. And hopefully we do that for low-income students, students of color, students who really require our services. That's kind of the pebble we push every day.
Minding the gap. Yeah. All right. Thank you. So room 5, it looks like we might have had a person or two fall off. So it looks like left from group 5 is Alexa, Kate, and Mark. And Alexa, we would challenge someone else from the group to share. So Mark or Kate, would you mind sharing a little bit from your group?
We had a bunch of specialists, I think, in our group, and I think Dina's leading her community group and really working on empowering those that are experiencing the root causes, experiencing the issues that we're talking about, because they have solutions that are not being heard or that can be incorporated and that we talked a lot about using our individual power and capacity to lift those voices up and bridge gaps between their ideas and their needs and their solution design versus the collective we that are holding those assets and resources that can be used or allocated differently. Kate talked about using her expertise in sharing and reorganizing community data and how to redefine what her role is moving forward. But it really just talks about lifting voice and empowering those that are using that data and how to understand it in a different way. And Alyssa has her role in connections to the VA, along with being one of the leads in our VA coalition here in Jackson County, to really focus on disparities, DEI needs in her organization, sharing stories and providing access.
Thank you. Thank you. Okay, well, that was all of the groups. So Amy or Zoe, any closing thoughts on that exercise before we move on to the next and final part of our agenda today?
Now, just keep asking for data that you need to drive the work, and then keep pushing those pebbles.
Yeah, and I put in the chat before the breakout, keep that pebble on your desk. Like, look at it, think about it, have it be there as a physical reminder for you.
Very good. Okay. And know that you're not alone. So our network, like, we are the network. I say we, meaning collective, all of us, we. So reach out to your peers, reach out to folks that you are in other meetings with or other conversations with, reach out to our staff team. We're here to help you. So we have coaches, Amy and Sarah, who are available to help you with that work. And you're not alone. You're not isolated. I know it feels that way more now than it ever did because of all this Zoom stuff. But we are here and we are available. So please keep that in mind as well. So on that note, I'm going to turn it back over to Monica, who's going to kind of close us out for the day. And then I'm going to come in with the boring stuff at the very end and talk about next steps and what you'll hear from us afterwards. So take it away, Monica.
I guess it would help if I was actually unmuted. Will you go to the next slide? There we go. So hearing Zoe talk about keeping that pebble on your desk, in our small group, we kind of talked about, sometimes you get a couple of pebbles in your pocket and they start rattling around and people hear that noise in your pocket and people are like, what's that noise? Stop that noise. And some people are like, what's that noise? What are you working on? Let's see that. Like, I'm interested. I want to come alongside you. Sometimes people put pebbles in your pockets, maybe pebbles you weren't expecting, and your pockets get kind of heavy. And that's when you reach out to Amy and Sarah and Alexa and Sherry. Today, we heard from Martha about just showing up and being present and listening and using that lived experience that you're hearing from the people you care about to change your work. And Kira kind of talked about that too in our smaller group, that, showing up in those small and big ways makes a big difference. When Angie spoke today, she was talking about this idea that she didn't change a policy. The policy didn't change, but the practice did, right? The practice of people who impact lives every day changed, and a whole hospital system and a transportation system, right? That relationship she built, she fostered building a relationship between two systems, and now that those systems are working together differently, that's amazing. And literally, when she said she felt like it was such a small thing, she was kind of embarrassed to talk about it. And we were like, oh my God, it was like that. That was a big, big rock. That was not a pebble. And, I think that the lesson we're learning from today is that we all have a pebble that we can move, and that we go from this idea that some people out there in the network are doing this work to I am in this network and I have this pebble that I have control or influence or leverage to change, and that it's changing that idea of systems change as a we that happens somewhere to an I, and I know that I'm not alone. And so I guess that's our pep talk. And you've hopefully connected with people today in your smaller group that maybe you could reach out to later. But remember, there's a larger group too of literally hundreds of people who are going to be looking at the same data you're looking at and having a similar pebble in their pocket, and that our goal of carrying these pebbles is to build a safe and thriving community together. And I think we can do it. We are doing it. And I think we can continue to do that. And I'm really super excited to see where we're going to go together. I see Tasha's comments coming in through the chat, and Megan. So we've committed to a lot of things, and if you need help with those things, know that you can reach out. And I'm feeling super grateful to be in this community in this moment, and know that we're having the right conversations and looking at the data in the right way to get us there. So Sherry, take it away. Did I miss anything? Nope. All right.
I think you covered all of the things and more. So that's amazing. So today has been amazing. I appreciate everyone sticking with us. 3 hours on a Zoom meeting is just about the definition of terrible. So thank you for being with us and for sticking with it all day or all morning, sorry. So my job is always to bring us back to, okay, well, what does that mean? What's going to happen from here? So this goes back to those interconnected circles when we talked about who the network is. As Monica mentioned, we're kind of moving from that collective we as we close our meeting today to moving into that I space. Like, what am I going to do after this? What can I expect from others? So as you can see at the bottom, our network staff team, we're going to make sure that you get access to all of the information that we've shared today, the chat, the things that folks have committed to, the things that folks talked about and committed to yesterday, feedback and input and all of those things. All of that's going to flow towards you. Give us a few days, but it'll all come out to you. The recording from today will be available. We're going to keep sharing information. We're going to keep making data and information available. We're going to keep providing you with technical assistance and support so that we can bring people together around things that are meaningful and valuable to your work that you've committed to doing. The Network Council, again, they're responsible for kind of helping collective impact be possible. They're going to keep supporting the work. They're going to help address any problem solving or removal of barriers that might be needed. So as those things pop up, problems that seem immovable, communicate those back to our staff team, to others on this group. The council's role is to really help our work be possible. And so creating opportunities for different kinds of conversations, creating opportunities for us to rethink how resources might be utilized. All of those things show up in that council space, but they're also going to be looking at, how did today go? How did yesterday go? What did people think? Was it valuable? Was it beneficial? Did you like it? Did it at all meet your needs? So that's one of the reasons why we've asked you for input. So I put a Padlet link in earlier in the day. I can definitely add it in, I think now. Yep, there we go. So this is really just a place for you to drop your thoughts. Let us know how it went. This is not the last conversation. This is not the last opportunity. We want to offer you opportunities like this that are meeting your needs and that are helping you drive the work forward. So that's where we need that input so the council can help us plan and execute those strategies there. Network partners. So this is where all the magic happens. Okay, this top level network partners, that's where system change happens. This is all of us that work in organizations that are part of systems going back and actually digging into that work that needs to happen. So this is from here, you need to work in close partnership with those that you serve. Those within your organizations, those within the community, grassroots organizations and others, to really explore, dig into those changes that need to be made and lead those changes so that we can start to achieve more equitable outcomes for our residents. And again, the network staff comes into that because we're able to help and support you in planning and execution of that. But the network staff isn't leading the system change. That's all of you. That's where the magic sauce is in our network model. So I would encourage you to be part of the training and technical assistance that's offered through our staff team. I would encourage you to engage in things like the anti-racism transformation team efforts, the community reads. I got a note about that coming up. Like there are so many great things helping this work move forward. So be a part of that. And I know many of you are. So continue to do that and stay on your equity journey. We as a network are committed to that for the next forever, obviously, but also for the next year and a half, we're working with our consultant to keep that focus internally and to help us move forward. But I know we're all on our own personal journeys as well. Stay on that path and reach out to others for help as needed. Any closing thoughts from others or questions about our next steps? We covered a lot and folks are like, whew, okay. All right, well, I want to say a big thank you to those that were part of the planning, those that were part of presenting and facilitating, and an even bigger thank you to all of you that were part of our day today. I appreciate all of the interaction, the conversations, the engagement. It's been wonderful. And I look forward to staying in touch. Yes, thank you, Tasha. Thoughts to keep in mind as we close. All right. All right, have a great day, everyone. Take care. Thank you.